things for trans people, period. And then for other folks who fall under the rainbow umbrella as well. Before I pass it to Ally, I want to ask the Trans Can Work team of Martha, Gabriel, and Jerome. We are doing workforce development at Trans Can Work. It's a small Trans Can Work. I'm the chair. Stand up, stand up, stand up. Martha, Gabriel, there you go. They are doing trans workforce development. And we are hoping to go national with the job board to get people jobs. Because we know in America, you can't get health care unless you have economic security. So I want to give a shout. Ally?
That's that's excellent work. I would really love to connect with you, so it would be a really great resource for me to have. So at Lambda, we do have policy. I chuckled when you said no large policy department because we super don't have a large policy department. But so many of our litigators also do policy, and a lot of our work is concentrated in litigation, which I am the queen of saying, litigation is not going to be our savior. We rely a lot on litigation. Litigation is an excellent tool, but it can't be our only tool. And so a large part of my work as the policy person, that's only my job, I don't litigate. I really try to make sure when I'm in rooms where we're having conversations, and I know we're talking about Black and brown folks, we're talking about trans folks, we're talking about trans women, I'm the one who's like, we're not making choices for people for communities we don't belong to, right? We're making sure trans folks are here, right? And are the ones who are leading what our priorities are, right? And a lot of times that answer is no. And so a big part of what I do personally, I can't even say this is an institutional thing, it's something I do personally, is I am always that squeaky wheel, like, why isn't MBJC here? Why is the TLC here? Why are we locking folks out? Why are we forgetting folks? You can't forget the most important people who are going to have the most important voices. And so it's going to know what it's like in real life to live that experience. You can't. Allies are amazing. They are necessary. We need folks who are not part of the community to also be being activists on our behalf, but they cannot be the main face. We have got to be the main face. Now, part of that is also making sure that everyone is supported and they are not feeling like they're just put out there and they're just being the face of something and then we're just stepping back, And so a safety piece is something that I'm always trying to think of as somebody who that's not necessarily part of my profession to think about. I do try to make sure we have folks who are trans folks who are at the table, but if this is something where it's too risky, I'm going to make sure there's somebody there who feels comfortable being there, and they are going to say exactly what that person who's too concerned with their safety, what they would say. So that's a big part of what I do personally, someone who works at Lambda, to make sure trans folks are being centered in conversations that most affect trans folks.
Thank you.
Yeah, and I'll just add, this is such a powerful room of folks and doing so many things. And I feel like we all bring different angles to this work, different histories to this work. And that's so important because we're not going to win without all of us, right? The thing that came to mind about some of ACLU's, I think, journey on how we're thinking about trans rights in particular. Look, ACLU is this 100-year-old, stodgy legal organization, right? And we've been used to, like you said, fighting in the courts. And I think there is the recognition that we might, the courts are not going to save us, right? And we know that they've been a great backstop, the courts, in many ways, but we have to be fighting in so many other ways. And one of the things that ACLU worked on recently was this big, messaging campaign called Freedom to Be. We had a big event on the mall a couple of weeks ago now, and there were folks from all over, trans folks. There were quilts that were beautiful, made by trans artists from across the country. It was a really beautiful event, a lot of trans joy, a lot of really focused on how can we get influencers and people who have various communities online and across the country to talk about trans joy and trans lives and what we need. So I think it was a recognition that we can't just be out here fighting in front of judges. We need to be out in the community and online and reaching people where they are to really talk about trans joy. So
thank you, Ollie. We got 2 more questions and then we're going to end the panel. Yes.
Hi everyone, my name is Bonnie Wiley. I'm part of Trans Joy Boise and we're chaplain based out of Boise, Idaho. And my question for you all, yeah, Idaho, not Iowa or Ohio, but Idaho, they're all lovely. My question is, a lot of, I think sometimes like we're talking at a national level and, like how it is with like spaghetti or some of these other things, like we're already living that in Idaho and some other states where we can access gender informing care on Medicaid or as young people, period. Our bodies are now criminalized in public. So I guess my challenge is, as somebody who does work in that area, is feeling like how do we connect to the bigger picture, and how can those who have more than we do, power, influence, resources, experience, really support those of us that are really struggling. Because I liked what you were saying, like don't the sky's not falling and don't pre-comply, all these sorts of things, but some of us are already there. And so what are these things as they keep coming, like what do you say to us? And what is it that our ACLU is fantastic in Idaho. We brought 24 of the 250 panels from our state for that. So like we're doing good shit. But sorry for my language. But we also are really challenged. We don't have the capacity, we don't have the resources, we don't have the oomph that we need. We're taking care of one another and we're showing up and like kiki, having coffee and like hugging one another and shit, which is important. But that's about all we can do for one another. And I'm just kind of curious what, I don't know. I don't know what the question is. I don't know if it's common. I'm just kind of curious.
So I would say HIV is not a crime. The Educational and Training Summit in Raleigh, we were there too, so good to see you again. And one of the things that I said to some folks is during the Civil Rights Movement, which is a movement that brought liberation to everybody that's in this room in some way, shape, or another. There were people who were great at marching. There were people who were great at transporting the marchers from wherever they were coming from to the mall. And there were people who were at home frying chicken. Each of us has a superpower or several superpowers. And for some of us, that's frying chicken. For some of us, it's writing a check. For some of us, it's helping somebody else to write a speech. For some of us, it's suing the hell out of the Trump administration. So whatever your superpower is, it is important that you utilize it, that you use it, that you offer it to others, so that we all can combine our superpowers and become our own sort of trans justice league. Because they're not going to win. They will win short periods of time. The same court that was basically handpicked by this a-hole of a president, I am cautiously optimistic that they're actually going to be the ones that will bring about his demise as well. And so whatever your superpower is in Idaho, and Aubrey was here, and I think she's tipped out in the back. Aubrey it not just talks about trans issues, but she also talks about the issues of immigrant folks. Whatever it is that your superpower is, make sure that you offer it to people, that you protect it as well, because at some point you have to get some rest. You have to drink some water. You have to turn off your phone. But share it with other people and create, we're going to use coalition a whole bunch of times today. Create coalitions with others who have superpowers that are different than yours, and sometimes the same as yours.
Boys that have literally Lincoln, North Carolina, trans folks in North Carolina are suffering. They got together once a month to do a fried chicken dinner. They get together, about 80 of them, and we across the country support that, where they get together and they cry and they say what they need. You need unity. Get with others who feel like you, even if it's just a meal. And for 2026, the coalition will be getting out to vote. My associate manager, Dafty, is leading an HBCU tour And the only way we're gonna get victory is to keep these people out of office. Vote them out. Go and tell people this is the wrong board member for Idaho. This is not a good person. Those are small things because you're working at the local level. Use your local power and vote these people out. And tell young people we wouldn't have been in this situation. What, 22% of young people didn't come out to vote? Just think if they would have instead of again. So create a local community, even with just cooking a meal. And ask for donations for that. Have food together and just support one another and stop listening to Fox News all the time. It's depressing. Have some joy. Have a glass of wine. If you do drink, have a glass of wine. And take care of yourself. And I'll pass it to my other competitors.
In all respect, like we are doing that, but like what more? Like we can only eat so much chicken, or strong for one another for so long. Like I don't mean that disrespectfully,
I got you.
but you know, what's the long game? You know, we're taking care of one another right now, but it's hard to think about how long we're gonna need to do this. You know, what's the long game? And so I think, and it seems as if there are states and there are programs and there are things all around the country that's doing really great stuff. And we're just in little Idaho that, you know, and politicians are like, we have no power, very little power.
May I jump in real quick also? So, part of that is going to be you all determining what your top priorities are. We hear it all the time. But that means determining what your top priorities are. We utilize an office management district. What are your SMARTY goals? You know, is this something that we can achieve? How long is it going to take us to achieve? And then, again, you've heard this before. Also, I think it's imperative that we set short, medium, and long-term goals for things that we can accomplish or things we want to attack. If the urgent priority in your community in Idaho is healthcare, then perhaps one of your short and medium-term goals is to get providers who will continue to provide gender-affirming care. How you can insulate them. That could be something that you can work on. It doesn't require a legal document for them to continue to provide care, or maybe it does. But that's something that you could work on. And then perhaps the next thing is HIV decriminalization. And then perhaps the next thing after that is making sure the legal markets. So you all will, and this is for everybody in the room, because what your needs are in Idaho are different than Raquel's needs, and they're different than Carmelia's needs in Alabama, and they're different than Brianna's needs. And so you all will determine in your community what your immediate needs and your top priorities are. Work towards those while always continuing to look forward as well, and redefining what those needs are. And let's be clear, this is a long fight. Yes, it is.
It's going to be a long fight, and the race is not given to the swift. It's given to the one who endures to the end.
Yes.
We're just going to have to maintain. It's depressing, I know, but it's going to be a long fight. He's got 4 years, and we've just got to stay on pace. There is hope coming, but it's a long fight, and we've got to gear ourselves up that we're in a battle, and we're winning small, but we will get to the end. We will get there. It's going to take time, though.
Yes, just to quickly add, because I know a big part of what you were wondering is how do we get resources from the very resources down to folks who really need it. And I think part of that is making sure we are in coalitions together. And I know we coalition that's thrown out all the time, but that is how you make those connections with those boards. And so join a lot of different coalitions that all meet different issues, like I was talking about earlier. There's one issue that affects our community. There's lots of different things. Join a diverse kinds of coalitions so you have different allies around, and hope and find some coalitions where there are some larger organizations. There's ACLUs, there's HRCs, there's land illegals, because we are in a lot of smaller coalitions, and we can take the message up the ladder, and maybe we can help do some resource shuffling and help folks. Maybe if you're having a fundraiser, help get the word out about that. And so I think trying to find connections with those larger groups that are looking to help support and amplify the voices of smaller groups, I think that is going to be one more concrete way you could try to connect that, bridge that gap between the the overly resourced and the under-resourced.
Ollie's gonna close us out, the answer to this question, and we're gonna have to close out.
Yeah, I so appreciate you bringing it up, and you all have a kick-ass community in Idaho that is doing such good work, and I think that idea of community, right? Like this is why we have these kinds of events. We know each other, we meet each other, we get those close bonds, and then when you have someone in your community that's like, oh, my hormone coverage just got cut off, like you can call Allie, call me, like let's write a letter together. If you've got a student who's having trouble in school, let's write a strongly worded legal letter to their board about what the fuck they're doing wrong, But we need to have those close relationships to each other to really make sure that we're getting into the community level, to people's real lives and problems, and making sure that people are getting the support they need wherever you are. So,
Guys, we love you. We got your back. It's a long fight. We're gonna keep fighting, and thank you.
Thank you. Big round of applause. I'm going to walk a transition, please. Shake your legs, get some water, do the thing that Ms. Tori asked us to do is take care of yourselves right now. Invite Rodrigo present to introduce your team and while we transition the stage. There it is. Panelists, please come forward to that Dee, Karen, and let's who else is in here? Liddell and Quentin. Ooh, these eyes. Hello. All right. Thank you, everybody, for your patience. We're going to regroup and do the next panel, which is on health access and health equity. We're going to go real quick, though, because we're running behind the overall program. So we have some fantastic panelists here. We're actually going to do quick intros and just one question from me, the board moderator, and then we'll open it up to audience Q&A. So think of whatever questions you want to ask already about health equity. We're going to try to shorten this panel up and make up the time to get back on track with the program. So appreciate everyone being flexible about the timing. To introduce myself, my name is Rodrigo Haymintonen. I use he, him pronouns, and I'm a trans rights activist. I'm currently not affiliated with an organization, but the way you may know me is that I used to run the organization Advocates for Trans Equality. Yeah. And before that, I ran NCTE, National Center for Transgender Equality, and had the chance to co-orchestrate a merger of NCTE and Telenet to create the new group A14E. But now I'm in my sabbatical era, taking a little bit of time off. But Dr. Miller reached out and asked me to moderate. So I'm out of sabbatical for just a little bit to join you all today. So with that, we'll turn it over to our panelists to do some quick intros. Want to start, Dee?
Hi, good morning, everyone. My name is Dee Senarathan, pronounced as she, her. I represent Plume Health. If you haven't heard of us, we are the largest telemedicine provider of transgender healthcare and transition support services. And we just marked our 40,000 patient in the United States. So super excited.
Hello, my name is Lindell Rubano, and my pronouns are he and him. I work for a not-for-profit Medicaid health plan in New York City called ImmuniCare. We are, our focus is really addressing the HIV epidemic. So we're members. What's significant is that over 4,000 of our 10,000 members identify as transgender or gender non-binary. So we purposefully make sure that they're meaningfully involved in our plan from every level, from the board all the way down to our staff, so that when people come into the door, they're able to see people who look like them, and we continuously make sure that we're including them meaningfully in our plan, and also advocating for and I actually prefer to say with them. So.
Hey everybody, I'm Quinn Reynolds, the founder and executive director of Game Changer Men. We are based in Atlanta, Georgia. We do work nationally, primarily with trans men and trans masculine folks, but we also have some youth programming around higher education and workforce development.
Thank you, Q. Good morning, everyone. My name is Karen Greensmith. I'm the Deputy Director of Policy at the Transgender Law Center. Yeah. I will just give us one plug in case you haven't heard. Yesterday or the day before in Kingdom v. Trump, we were issued a preliminary injunction, meaning that the federal government cannot enforce its ban on care for folks in places of incarceration. And we were also granted class status, meaning that folks across the country can join this case and make sure that we all have access to trans-affirming care.
Yeah.
Anyway, lots of good news. And that was our legal folks, I should say. That was our litigation shop, who are incredible, and I will shout that out. We're gonna jump now into the one and only question that I'll ask as moderator. And again, then we'll open it up for audience Q&A. So please think on that. So my one question for everybody on the panel, and think maybe we can start with you, Dee, and just go down, is what innovations or policies are we seeing that can be scaled nationally for health equity? So thinking about what are concrete things we can do and push for in our local communities, take it nationwide, that can improve conditions even in this negative environment we're in.
So thanks for the question, Rodrigo. I'll give you two responses and I'll keep them really concise. The first thing that we're seeing considerably, and this is really sort of what Plume was founded on, is the availability and accessibility of telemedicine. And that has really transformed the healthcare landscape. And if you think 5 years ago, for example, telemedicine really wasn't a big thing, and then the pandemic happened. And guess what? Telemedicine became something that everyone got comfortable with. What telemedicine has done to trans healthcare is it has enabled us to address care deserts. So think about your rural communities and places where folks cannot easily access care. That has been a really significant change in enabling people to access the care from the safety of their homes and be able to access high quality care, which is also super important as well. The second big thing that we're starting to see right now actually is, given the political environment that we're in, is an emergence and appetite for public-private partnerships. And what I mean by that is, think about all of the attacks we're seeing right now in terms of federal funding that's really trying to attack the health system. And as some of our previous speakers spoke to, where they're trying to remove federal funding from organizations that provide the care, or they're trying to remove federal dollars from covering the care. And what we're seeing is this intentionality of creating an ecosystem where some of those parties can partner with perhaps the private sector, with players who are insulated from federal funding threats. And so we're seeing something really interesting materializing and morphing as well. And the goal here is something that we all share collectively, which is to ensure that trans patients continue to have access to care. And that's sort of our collective goal. But those are sort of two high-level items that I'm seeing from an innovation standpoint.
I love that. And actually, sorry to throw us off here. Why don't we go to you next, Taryn, because I know you have another time commitment issue.
Thank you so much.
Sorry about that.
Yeah, I want to bring in Colorado, which just this past month passed an incredible law that would establish trans-affirming care as essential health benefit in the state, regardless of whether trans-affirming care is an essential health benefit at the federal level. It also delisted testosterone from the, I'm going to get the acronym wrong, but from the drug scheduling. Thank you very much. Can I say it out loud? So
PDMP.
Thank you very much. Meaning that folks who use testosterone can't be surveilled intrusively and then potentially removed from using testosterone. So there are states doing incredible work across the country, and we know that essential health benefits are at risk at the federal level. So while I can't say that this is the answer to policy across the country, there are states who are doing important work. And then I want to echo a lot of what was said in the last panel, which is community. Trans folks accessing affirming covered care is relatively new. And before we could access care that was completely covered, trans folks in many states can't anymore. But before we could, we provided for one another. And I want to just re-emphasize the importance of community of trans folks caring for one another. As we say at TLC, care is our legacy. We've always provided for one another. We've always been there for one another. And if there's one thing that we can iterate and advance to a higher level, it's always those iterations of care, those iterations of community, those iterations of making sure that we're there for one another. We're there around the chicken dinner to find out who needs the $5 that we're all passing around that month so we can make sure that they get the money that they need.
Okay, so for me, one of the key things that we need to keep doing is be cognizant, as we're saying here, where you are. Like if I live in a state, there's one of those blue states. So we have a state that actually has shield laws that are meant to protect people's access to gender affirming care. But they're not, but with everything that's going on, the environment is changing. So what we found that we have to do is really talk to trans advocates in the state, work with them and hear from them and understand how those laws need to be changed and then advocate for those changes. Like New York is in the process of, and we think it's going to pass. There's a bill that would strengthen the shield laws to get rid of any loopholes that could be used from malicious people in other states who are trying to get attack trans people who come to New York for trans care. But beyond that, I think we need to keep thinking about how we make it easier for people to access care. I work in the HIV space, so there are innovations that are coming out with HIV, which are the really ultra long acting treatments for HIV, treatments for HIV prevention. And we're also thinking about how do we make sure people have access to that so they have less interactions with the doctor, right? Critically, with the attacks on diversity, engagement, and inclusion, I always like saying them out because when you say that's being attacked, it sounds very ugly, right? But I mentioned in my introduction the fact that we are integrating transgender people throughout our thinking about how we operate. Because in a way, this moment is an opportunity for us to demonstrate what we mean by that, by diversity, by DEI, right? We need to make sure, one thing we can do and they can't stop us from doing is making sure that when a transgender person comes into our spaces, they feel welcome. They feel like they belong there, they can access services and don't feel like they're out of place. You know, and we don't need to wait for the federal government to do that.
Thank you. Quentin?
Yeah, so a lot of our work has been done in the South, as I previously mentioned, and so we don't have the privy to, have those protections or different services that's in some of the blue states or some of the states that have more affirming laws for trans folks. And so one of the things that we have been doing, or we do, utilize coalitions and partners, right? And so some of this looks like working with different healthcare providers that are trained in affirming through, right, trans-led organizations, not just saying that they are, but also working with different partners that have different resources, right, like clinics that they might have, and making sure that they're affirming, and we send folks over to those different clinics. One of the other things that has been successful is like the pop-up mobile clinics, right? Sending out the mobile clinics to different different areas, because we are based in Georgia, right? And it's a lot of rural areas where folks sometimes I myself have to drive an hour to a healthcare provider, right? Because I live in a more rural area. I don't live in the city of Atlanta. And so making sure that also when we're thinking about the different services that we need, that we are, it's a red state, so the state legislation is kind of bad right now in Georgia. And so making sure that we also are putting pressure on our legislators as well. Because we do have some allies, but also making sure that we let them know, like, hey, if you all are, you have a huge trans community in Georgia. And so let them know that if you all aren't representing all of your constituents, then we can get you out and vote you out. And so putting that pressure on them, especially as we think about the upcoming election and midterms of 2026.
Amazing. Thank you. Love the variety of different kind of ideas out there, different models, state, local, federal level, and just institutional level, irrespective of the policy. With that, we'll open up for Q&A. Any questions out there from the audience? We have silent group now? What? That's not what our community's normally like. Well, okay, think I saw. Thank you. Sorry, I kind of see with the lights here.